21st Century Cures is an initiative that basically started out as an idea in Chairman Fred Upton's mind, I should say. He's the chairman of the Energy and Commerce Committee. He's a Republican, so he's the chairman, and I'm the Democrat, so therefore I'm the ranking member. We're the leaders of our respective parties on the Energy and Commerce Committee that has jurisdiction over healthcare, NIH, CDC, drug approvals, medical device approvals. And he decided to work with Diana DeGette, who's a Democratic member of the committee, because they felt that collectively more needed to be done to cure diseases where we haven't really made much progress. And they basically, our committee, or the health subcommittee of the Energy and Commerce Committee, went around the country and basically had hearings and forums and tried to get ideas, in the hinterland, so to speak, about what should be done. A lot of the input came from, I would say, disease-centered groups, that focus and raise money and ask for more research on a particular disease, for example, ALS, for example. A lot of the impetus, as I said, came from advocacy groups. I call them disease-specific advocacy groups because oftentimes they are. And of course, most of those have chapters in my district, or at least in New Jersey, and they come to visit on a regular, either here or in DC, and they usually say that they'd like to see some innovative programs so that there's more money for research or expedited approval. I mention ALS because, for example, ALS had one of their walks a couple Sundays ago, not this past, but the Sunday before, I think, here in Long Branch. And when I was there, they were talking about expedited approval of drugs, more research. So typically, that is what we get from a lot of the advocacy groups, both here at home plus in Washington.